Two viewers. Ano ba to? Study Nclex with me. So, welcome to my live. Oh, I hope may mga students here na studying Nclex. Welcome to my live. So, we have 4 viewers. Study Nclex with me. So, I hope na may mga student dito or nurse. And let's be polite and be mindful of our words. Let's be kind. Don't do bashing. Positive vibes lang, no? Hope you can subscribe to my account if you're a mom. I'm also a nurse. And right now I'm reviewing for the Nclex. So my purpose in doing live is also to um, gain some insights from the nurses or the students who are taking Nclex. I know. Konti lang viewers pala pag ganitong oras.
Okay, last stroke. So because your face an even grouping of one side, okay? Uh, if you can remember, Tas Gina Parinis is one of the best actresses in the Philippines. Then they have Marta Clara, di Catherine Bernardo, and so Gina Parinis, Clara, Gary. So that is, di ba? This articulation. So you have to ask the patient, I cannot understand the patient. That could be stroke, guys. Stroke. So one way to assess the patient is let him repeat a phrase. Okay. All right, patient, repeat after me. Today is a good day. Patient, okay. Today is a good time. Australian, Australian, sorry. This in Australia. Okay. But the patient says, that could be very strange. Okay. So when you say repeat after, it's just simple face, guys. Do not say, okay, patient, repeat. Michelle goes to the seashore and collects seashells from the seashore. Do not just those things, guys. Alright, so if you assess all this, is call 911, huh? Okay, call 911, okay. So, Michelle, collect seashells from the seashore, and my card pays me, guys. First, you be merciful to your patient. Okay, next one, stroke. So, here we go. So, the pay patient. The student told me in the trending art, they will just send me class what came out in the exam. this is the good this is a good thing about IPAS because of course they are family. So they also gain from the previous students. So this is giving back to the community. Sir, these are my things that came out in my exam. These are the topics are. But yet there are even students that weren't even officially. Oh my God. There's like guys from Jamie told me, like, just try to find way to change the word mentioning topics, no, because we might be we might be accused of how do you call this one? No, by the people and but anyway, okay, this is just the topics given to the student. So how you got? So guys, a right hemisphere stroke can be to left because of the contralateral. So if the right brain is affected, it's on the left. Okay? So left hemiplegia, left-sided sensory deficit or numbness, unilateral neglect. Okay? So I say unilateral neglect plus is the neglect of the paralyzed side. Okay? Neglect of the paralyzed side. Get poor spatial and depth perception, poor concentration, left homonymous hearing anopsia. Okay? So this is loss of half of the visual field, visual spatial disorder, disorientation, difficulty with task, requiring spatial awareness. Okay, so screenshot at one guys. I think this is a SATA. This is a SATA, guys. Extended SATA, I think. Okay? Extended SATA. Alright, next one. Okay. Sorry. Screenshot, please. Screenshot, ladies and gentlemen. Serve as the first slide of the stroke for a while. This is the first slide of the stroke, guys. Guys, sorry for those I wasn't able to read, guys, ha? Your request, guys, for the slide, guys, because the chat box, I am having difficulty of going up. the chat box. So I can go if I can read it immediately. But anyway, there is a recorded for this. Do not worry, guys. Do not worry, there's a recorded. So you can go back to the recorded and screenshot there. Okay? Screenshot there in the recorded. Okay. So, can we have warm soap sa top na pagpapag? Yeah, you can have warm. Okay, as long as it's not the hot one. Okay. Okay, so somebody's asking for the... Okay, this one, guys. This one for the pad, the table. Okay, somebody's asking. So you can have warm, but not hot. Because warm is different from hot. Warm is, I think, in Tagalog, it is maligamgam na tubig. So it's between cold and warm. It's cold and hot is warm. Do not use the hot. Of course, you will know what is hot, guys. If you will full blast on the hot side, if you are in the USA, there's cool and hot in the water. If you full blast, that's really hot. So do not use that one. Okay, so done. Okay, done with the table. Okay, done with the first line of CDA. 5, 4, 3, 2, 1. Okay, next, let's move on. Okay, so guys, before giving medication with stroke, we have to test first. See this time. Or we cannot MRI also. Because we cannot give the drugs plus because it will depend. You cannot give the anticoagulants. You cannot give the antiplatelet. You cannot give the thrombolytics if the cause is hemorrhagic. So know the cause first.
Dito. Grabe, pinili ito sa mga ano. Butang mga dengue. Pa rin. Okay naman. So, naman students dito. I'm not here for dating. I'm just looking around for some students or nurses that also review for Nclex. Anyways, thanks for coming to my live. Oh my God, Epa. What's that? Gusto po. Parang dating app ng YouTube. Sobrang yummy. Sumulong na.
Okay? No the cause of stroke. Okay, first. So that's why you have your sleep. So management is ABC. What is ABC? Airway, breathing, and circulation. If the patient is unconscious, sideline, range patient. If conscious, you can have 7 hours. Then avoid contractures, you have your split, your diet. Talk about Nclex, it should be soft. Soft. And when the patient is eating, guys, it should be upright. No? Upright is eating. Check for the gag reflex, upright, sit upright. Diet is soft. Okay? Diet is soft.
Are you a Korean?
Avoid cream liquids because they can cause dysphagia.
I look like a Korean. I'm a Filipino.
So next one before leaving, I think this is still the same. Sorry guys, screenshot is one piece, guys. Okay. Screenshot is one piece. I'll just get my water on the side.
You look like a
And
Korean.
then this is another one again. Homonymous meaning anopsia is how do you determine homonymous? Half of the food in the plate.
No, I'm not a Korean.
Because when you say homonymous meaning anopsia class, this is loss of half of the resource.
I hope so.
Loss of half of the resource. Okay. And then for unilateral neglect, what should be your estimation? So by the way, what is unilateral neglect? When you say unilateral
From the
neglect of the
Philippines, I'm not
paralyzed
here
side,
for
so for
dating.
example,
I'm
the
just
patient
here
is paralyzed
for
side on the left. The patient seems to forget the left side. So what will you do? Let the patient stand by the left.
my
Patient,
review,
look to your right.
for my Nclex.
Patient, look to your left.
And if you're a nurse, shout out for all the nurses. Shout out to all the nurses who are working
So that is the first punishment for unilateral
hard
neglect.
every day and
Next one,
not
guys.
quitting.
Aphasia. Okay. So for expressive aphasia, what do you mean by expressive aphasia? Cannot speak. Cannot speak. If expressive aphasia. So what is our nursing management? Writing pad, magic slate, pointing to a picture. So the pictures plus are with the ADLs. Okay. Okay, patient. So since the patient cannot speak, you will just point. You want to eat? Patient, what do you want to do? There's a picture of picture of a person in the toilet. You want to have bowel? Pointing to a picture. Okay? Because the patient cannot speak. That is aphasia, guys. Okay, that is the meaning of aphasia. Okay, for receptive aphasia, guys, this means, okay, we're talking about aphasia, guys, ha? For receptive aphasia, this is cannot understand. Cannot understand or cannot comprehend. Okay. Cannot understand or cannot comprehend. Okay. So use short, simple sentences. Keep it short and simple. The kiss. Okay. Do not shout. Okay. If is receptive. So guys, okay, screenshot is one piece. Ladies and gentlemen. Okay,
Always drink your water, guys.
5, 4, 3, 2, 1. Okay. 5, 4, 3, 2, 1. Okay, next one, stroke. So stroke is a dead brain tissue, by the way. So two types. Again, this
Right
is now
now
an
I'm
overview.
studying
Again, so
about
hemorrhagic cause
stroke.
is bleeding from rupture. It could be because of the high blood
So
pressure. Then position
even
is
if
head
you're
onward elevated.
younger
That is
or
really So
older,
it depends on the
doesn't
case. If the patient is
matter
unconscious, we can do the
anymore.
sideline fully
Stroke
unconscious.
can
Okay? But if the patient is semi-conscious or conscious plus head of the elevated. And that is also for hemorrhagic stroke. And not also fine for ischemic stroke. So it depends. I sorry. So positioning it depends. No? But usually class for the positioning class we have
we
this one.
don't play the Korea.
Sir, so kanina, actually guys, for ischemic, you can also have head of the elevated.
Swim, bleeding from rupture.
You can also have the plan. Okay? There's nothing to worry, so you can have that. But if, again, if the situation is telling you that there is a high risk of aspiration and the patient is unconscious but high risk of aspiration, that's the sideline. To drain the secretions. So case to case basis. Okay, that is case to case basis, guys. Alright, so 5, 4, 3, 2, 1. Nice screenshot, guys. Alright. Now, next one, how about right-sided stroke? So this is a question from the student position of the wheelchair. So unaffected side is stroke. And then most common cause is plaque. Problem is occlusion in the cerebral artery. Warning sign of stroke is TIA. Are you familiar with TIA? This is your transient ischemic. Sir, so actually guys, for ischemic, you can also have head of the elevated. You can also have the plaque. Okay? There's nothing to worry, so you can have that. But if, again, if the situation is telling you class that there is a high risk of aspiration and the patient is unconscious but high risk of aspiration, that's the sideline. To drain the secretions. So case to case basis. Okay, that is case to case basis, guys. Alright, so 5, 4, 3, 2, 1. Nice screenshot, guys. Alright. Now, next one, how about right-sided stroke? So this is a question from the student. So can I speak? We'll just point. You want to eat? Ladies and gentlemen. Okay, screenshot this one, please. 5, 4, 3, 2, 1. Okay. 5, 4, 3, 2, 1. Okay, next one, stroke. So stroke is a dead brain tissue, by the way. So two types. Again, this is now an overview again. So hemorrhagic cause is bleeding from rupture. It could be because of the high blood pressure. Then position is head of the elevated. That is with this ICP. So it depends on the case. If the patient is unconscious, we can do the sideline for the unconscious. Okay? But if the patient is semi-conscious or conscious plus head of the elevated. And that is also for hemorrhagic stroke. And not also fine for ischemic stroke. So it depends. Sorry. So positioning it depends. No? But usually class for the positioning class we have this one. Head of the elevated. Sir, so actually guys, for ischemic, you can also have head of the elevated.
I have water with me.
Okay? There's nothing to worry, so you can have that. But if, again, if the situation is telling you that there is a high risk of aspiration and the patient is unconscious but high risk of aspiration, that's the sideline. To drain the secretions. So case to case basis. Okay, that is case to case basis, guys. Alright, so 5, 4, 3, 2, 1. Nice screenshot, guys. Alright. Now, next one, how about right-sided stroke? So this is a question from the student position of the wheelchair. So unaffected side is stroke. And then most common cause is plaque. Problem is occlusion in the cerebral artery. Warning sign of stroke is TIA. Are you familiar with TIA? This is your transient ischemic attack. Transient ischemic attack. Okay, hemiplegia is drifting of one arm. Slurred speech, we have asymmetrical smile. Okay, so, and remember the fast. Okay? Just remember the mnemonics is fast, guys. So if you have that one, fine, call 911 immediately. Okay? Call 911 immediately. Okay, so the fast is there on the previous slide. What is faster? Face, arm, then speech. So next, ladies and gentlemen, let's move on. Okay, here we go. Okay. Another topic. Guys, I think it's already 10. Okay, I will put the number of my video, guys. Okay, let's have a break first. Okay, let's have a 20-minute break. Okay, 20-minute break, ladies and gentlemen. Okay, thank you so much, Sir Mark. Okay, so our next topic. I don't know where this 500 slides is. Those were the old slides also. So of course, I updated
I can't
them.
understand.
So let's have this one. So I think this will be appendicitis, okay, versus pancreatitis versus cholecystitis. So there was a talk about this one. Okay, so actually that is appendicitis. So for the timestamp, you can have the appendicitis or not. Okay. So guys. Okay, sorry for that. Sorry for that. Thank you so much. Let's have this one first. Okay, so for the timestamp, can you see it now? Can you see it now? Okay, I hope that is okay. So appendicitis, guys, is the next topic. So what are the risk factors? So you have your first fecalith. Okay, this is your most common. Okay, so this is the most common. Because when you say fecalith, guys, this is also known as your hardened stool. Okay, so you have your hardened stool brought about by the undigested food. Okay, so undigested food, so it becomes hardened. So this will lead to your obstruction, guys. Okay, plus a decreased fiber. So basically, this stool here can lead to your obstruction. Okay? Obstruction. Where is obstruction? Especially in the cecum, where your appendix is there. So if there is obstruction plus, okay, like for example, okay, this is the cecum, this is the appendix here, and this is the large intestine going there. So this is the ascending colon. So if there are fecal lift here, nurses, like for example, this is the fecal lift, this is the undigested stool. So the bacteria, the toxins, instead of going there, it will shoot into the appendix. Okay? Ang mga toxins or the toxins and the bacteria, okay, will shoot into the appendix. Okay, so again, so we have your, sorry, I'll just need to change this one. So the bacteria or lodgement of the bacteria and the toxins. Okay, so arrow down. So there will be your lodgement of the bacteria and the toxins into the appendix. Okay, so it will lodge. So since there is a bacteria plus, of course, what will happen? It will result to the inflammation. So it will result to the inflammation. Actually, guys, I asked the doctor, doc, is it true that if you are jumping after eating, you will have appendicitis? Rather than, my friend doctor said, right, that's not true. Because that is what our grandmother is always saying. Do not jump after eating because it will cause appendicitis. So it is not, guys. It's the fecalith, okay? That will cause obstruction. It is a decreased fiber. So if you're not eating fiber, you will have hardened stool and it will obstruct. The hardened stool will obstruct here. So instead, the toxins will go out from your body. It will go to the appendix, the toxins and the bacteria. Okay, so screenshot now. 5, 4, 3, 2, 1. Sorry guys for the stool, guys. It's green. The stool are green. Okay, there's no brown here. Okay, let's change it on into like this one. Huh? Okay, that is the stool or the hardened stool. Supposed to be in the ascending. The stool should not be hardened. It's still mushy. It's still sometimes it's still watery. So it will be formed in your point. But here, plus it's abnormal. Okay, so this is abnormally hardened. Okay, abnormally hardened stool. Okay, supposed to be it should be mushy there or it should be watery and still watery in the ascending part. Okay, so what will happen? So arrow down. Okay, there is a pain. So we all know this one question of appendicitis plus the pain is in the RLQ or also known as your McBurney's point. It is also known as your McBurney's point. And the pain here is steady. Steady, vague, dull. Okay. And you have your Bloomberg sign. So your Bloomberg sign is also known as your rebound tenderness. It is known as your rebound tenderness. So what are we going to do here? Yes, we palpate. What we are going to do here is to palpate the RLQ. And then the result is positive pain at release. Okay. So palpate RLQ, then release. If there is pain upon release, that is the rebound tenderness, also known as lumbar. Steady, vague, dull pain. Okay, that is a pain. RLQ. And then rub 6. So in your rub 6, guys, you have to palpate LLQ. Then what will be the result? Result is positive pain in the RLQ. In the RLQ. Okay. And then psoas sign. So psoas sign, guys, is how do we elicit this one? The patient in supine position. Then after that one, right leg, okay, cross. Okay, cross the right leg. So it seems like number 4. You are forming a number 4 in your right leg. Then when you cross the right leg plus, what will be the result? Positive pain. Okay. In the RLQ. Okay. In the RLQ. So that's it. So you lie down, you cross your right leg. Okay. You cross your right leg, so it is like a number 4. Okay. And then you have your nostril vomiting area. And last but not the least, is you have your fever. Okay. Last but not the least, guys, is your fever. So the fever here is low grade. Okay. So it's a low grade fever, ladies and gentlemen. Okay. So guys, screenshot please. Okay. 5, 4, 3, 2, 1. Before I will add, guys. I will add a little more. Complication is rupture or perforation. And of course, if there is rupture or perforation, it will lead to your peritonitis. Okay? Peritonitis. Okay. So rigid board-like abdomen. You know that one, huh? Okay. So there is your rigid board-like abdomen. Okay, so it's not soft. So sometimes in your exam, if people say patient following are precise or should be a concern for appendicitis, exempt. So exempt the soft abdomen because it should be rigid if you have peritonitis. Okay, so time to straight shot now, guys. Okay, 5, 4, 3, 2, 1. Okay. Next one, diagnostic test is CBC. So WBC, of course, normal value is 5,000 to 10,000 cells per mm3. Okay, so the result, guys, it will be increased. So if there's increase, there is a positive for infection, or we can have your inflammation. Okay, of course, there is infection because bacteria are lodging. And for the X-ray, is positive for intraperitoneal air. So if this is the result of X-ray class, this could indicate rupture. Okay, this could indicate rupture. So guys, there's a word here. Indicates rupture. So what should you do? Prepare for surgery ASAP. Okay, prepare for surgery as soon as possible. So don't let the patient go home. Okay, doc, I want to go home. I want to get my clothes. Patient, no, you don't have to go home. Let your family get your clothes. For example, during check-up, the doctor find out that there is rupture upon the X-ray or upon the abdominal ultrasound. So you can also have ultrasound, guys. There is rupture. So don't let the patient go home. Direct to OR. But of course, the doctor will explain, guys. The doctor explained, ma'am, because, guys, it happened to one of our friends, guys. She told us, right, I almost died, right, because I didn't know that there was fracture already, because sometimes do not be sick, because if you have appendicitis, and then if the pain cease, or if the pain stops, or if there is sudden absence of pain, do not be decided, it's okay, there's no pain anymore. Because, again, in appendicitis, that could be a sign of fracture, sudden absence of pain. So that is what is happening to our friend. So during the diagnostic test, the ultrasound, abdominal ultrasound, I think, and then X-ray, or abdominal X-ray, it was found out that there was already a rupture. So that she was really, of course, she felt anxious, guys, and the doctor, do not go home, let's go directly to the OR. And then she told the doctor, no, I need to go, I need to get my clothes. Let your family get their clothes. Okay. Of course, she trusted the doctor, guys, because that is her family doctor also. So we need to give you your surgery because this is, it might be toxic in your body because it's already rupturing. It might go upward, it might spread, the infection might spread. That is the explanation of the doctor. So good thing she listened, guys, or else, dead ball. Okay, sir, it happened to me, sir, ruptured, sir, kasi na-misdiagnosed as kidney stone. I was taking pain medicine until 4th day, I was rushed in. Sir, what's the difference between Bromber's and McBurney? McBurney's point class, McBurney's point is the area. Okay? Sorry. Your McBurney's point is the site. This is the size of the R. This is the other term for RLQ. Okay? The Blumberg's for the rebound tenderness is the same. Okay? How do you elicit the Blumberg sign? Blumberg is also known as rebound tenderness. Palpate RLQ, release. When you release, if there is pain upon release, that is rebound tenderness. Also known as Blumberg. McBurney is the site. Okay? I hope it is clear, Ma'am Niza. Okay. McBurney is the site. Okay? See, Ma'am Jera? So that's why sometimes it's misdiagnosed, guys. Dala ng neighbor daw, dala nagmanifest as a friend walking. That is I think from the past. Okay, now let's proceed. Okay, by the way, guys, okay, time to screenshot. Okay, so again, international students, somebody is, if I speak in Tagalog, I was just reading their comment. Okay, so do not worry, international students. I will speak in English, and if ever there's need a translation, I will translate it for you. Do not worry. Okay, now let's proceed, guys. Okay, for the diagnostic test, guys. Okay, here we go. Screenshot this one. You can also abdominal, you can put number 3 here, class. Okay? You have your ultrasound. I'll just put UTC. Ultrasound for the number 3. 5, 4, 3, 2, 1. Okay. Now next one, nursing management, minimize pain. Heart position, if not rupture. So guys, you all know this one, guys. If there is no rupture yet, okay, knee chest. Okay? Or guys, the legs are drawn to the chest. Legs are drawn, okay, to the chest. Then if rupture, it is semifallers. Okay? What is the reason? This is to prevent, okay, upward infection. To prevent upward infection. Then, avoid narcotics because it may mask the pain. Okay? So before surgery, as much as possible, this is from, you know what, guys? This is from Saunders. But there are some book plus. Here we go, huh? Okay. There are other book, like for example, for Brunner, the answer is give analgesic. So, sir, what will we follow, sir? According to Ma'am Rosana class, if there is conflicting from each book, it will not come out. It will not come out in the exam. This is actually true. There are even books plus they have conflict. Okay. So again, I think it will be more on face-to-face basis, guys. Okay, it is face-to-face basis. So again, why? The reason of Saunders is this. Okay, and I get their point. Why are they not going to give narcotics? Because if you give narcotics, guys, and if the pain subside, you cannot distinguish if it's because of the rupture or it's because you give the medication. Okay? Unlike if you will not give pain medication, as long as the patient can tolerate, if you will not give medication, if the pain is absent or if there is sudden absence of pain, so you know it's rupture because you did not give medication. That's the point of Saunders. Right? But in Brunner, give medication. In Brunner and Saunders, give medication. So guys, okay, if some lecturer will say give medication, it's okay. If some lecturer will say do not give medication, it's okay. There's nothing to worry because that's based on book. Hello sir, what if sir it will come out in the exam? Just pray. Okay, so I joke, guys, kidding aside, guys. So again, that is from the Saunders, guys. But of course, after the surgery, we need to give the medication after the surgery because of course there will be pain after the surgery. So give your morphine after the surgery. Okay. So here I will just tell you guys that either which is correct. Okay. Give medication or not give medication, correct. Okay. So as far as what Ma'am Rosana told me, she right. It will not come out in something there is conflict. Anyway, so do not worry, guys. Sometimes when we worry on the thing, it will not happen. Huh? Okay, if you keep on worrying, why worry on the things that will not happen? No? Okay. And watch out for the signs and symptoms of rupture. So this is what I'm telling you. The sign and symptom of rupture, guys, is sudden absence of pain. Huh? Okay. So we have the sudden absence of pain, ladies and gentlemen. And another sign of rupture is we have the rigid board-like abdomen. Rigid board-like abdomen. Okay. Sir, why, sir, this is a sign of rupture, sir? This to be peritonitis nurses. Okay. This to be peritonitis. All right. So those are the important issues. Sir, ano pong semi-fowlers? Ma'am Marie Antoinette. Okay. Semi-fowlers. Okay. Maybe after permitting appendicitis, maybe analgesic. It could also be, yeah. But again, that is the best one, guys. It's the best from from Saunders, it is do not because kidney mastectate. Okay, kidney mastectate. Okay, so SF is semi-followers, by the way, guys. Okay, so this is your semi-followers to prevent upward infection. So it depends on the position if rupture or not rupture. But of course, if not rupture, knee chest. What is the knee chest? Plus the legs are drawn to the chest. Or the knees are drawn to the chest. Diba? If you have abdominal pain, any abdominal pain plus, what will you do, guys? Aray! You will do that one. Okay? Nobody is having abdominal pain and will say, aray! It will cause more pain because the abdomen is aray, knee chest, okay, your legs are drawn to the chest, aray, abdominal pain. No one is telling aray and then you are pilita coralis. So, this is the position of comfort, okay. Now, next one, okay, prevent rupture. By the way, guys, if you want to screenshot, guys, screenshot down, okay, screenshot down. So again, for the giving of medication, it depends on the situation, okay, it depends on the situation, guys. Okay. So let's proceed. Prevent rupture, avoid hot water baths, cold compress is correct. Avoid enema and laxative because this can cause irritation. This can cause irritation, guys. Okay. And surgery ASAP if rupture. Okay. If rupture. How do we know if rupture again? Sudden abscess of pain. That's why, guys, that is the point of Saunders. Do not give medication.